And with me now is Jitesh Ghai, CEO of Hyland. Welcome.
Tiaja, great to be here. Thanks for having me.
AI is advancing really fast, and now we're talking about agentic AI, agentic workflows. Can you explain in simple terms what does this mean for clinicians, for the workforce?
We are the trusted custodians of all unstructured documents, enterprise content within hospitals, within healthcare systems. And from those documents, we're also enabling the automation of business critical processes within these healthcare systems for back office operations, for clinical operations, and ensuring that all of this is done in a governed manner. We are now leveraging all of this investment that our customers have made, and we're automating it with AI for agentic automation outcomes to really realize the agentic hospital, where all the process-intensive business processes are offloaded to agents so that organizations, healthcare systems, hospitals can focus on patient outcomes, can focus on clinical efforts to drive greater patient care.
That's needed a lot in healthcare. It sounds great, to just automate agents as well. But clinicians and healthcare are risk averse. They might have fears around trust. So how do you make sure that, AI agents automation is implemented responsibly? How does Hyland take care of that?
Great question. Our innovation principles are your data is yours, and we will AI enable your data and your business processes wherever you would like them to run, wherever you would like your data to. So in your tenant, in your data center, that's one principle. And we enable our customers to use whatever model of their choice. We're open and modular. So we have large language models out of the box. We have small language models. We enable our customers to use ours as well as any of their choices. And so your models are also yours. The models are tenanted so that each of our customers gets their own models. And all of this is using the same foundation of governance that our customers have used for decades, ensuring trusted consumption of this data for trusted agentic decision-making, and doing so and ensuring that it is transparent so that when you need to go back and look at what decisions were made and why, you have access to all of this information to do so. The combination of all of this enables organizations to rely for very specific non-clinical workflows, only operational, clinical operational, back office, finance operational, HR operational workflows, pharmaceutical operational workflows, offloading those to agents, but on this infrastructure of trust, governance, transparency, with the confidence that the data is theirs and the flexibility of using any model they'd like.
AI presents an opportunity not just for healthcare, but also for healthcare vendors. You specifically are debuting two new solutions, intelligent med records and intelligent correspondence for revenue cycle. Can you tell me a little bit more about what specific problems are these two offerings solving?
Yeah. Intelligent medical records and intelligent correspondence for revenue cycle are agentic document processing offerings. So think of your most document-intensive business processes. In the case of intelligent medical records, organizations get documents, millions of pages that need to be processed. We have agents with intelligent medical records that are able to scan, process all of these documents, extract the necessary information from them, and automatically integrate them into multiple systems of records within the healthcare system, resulting in faster integration and more up-to-date insights for clinicians to drive patient care. Similarly, for intelligent correspondence for revenue cycle, our agents are enabling faster correspondence, faster understanding of billing and processing with various insurers to ensure faster economic outcomes for the healthcare system itself. All agentically processed, all very document-centric, all on a foundation of governance. Our customers are realizing millions in productivity-based gains by freeing up analysts, clinicians from focusing on the mundane, repetitive tasks to focusing on the really tough problems that matter for healthcare providers.
Sounds like huge improvement in productivity, in optimization. So when it comes to optimization, where do you see the biggest impact of automation?
Yeah, we are exclusively focused on operations. Back office operations across every department, whether it's finance with AP automation, HR automation, pharmaceutical operations, as well as clinical operations, not clinical workflows, but the operations that support the clinicians. We are building multiple agentic solutions to make the processing of information faster and deliver unified views of trusted, governed information across every department within the agentic hospital.
AI is everywhere, which also means that healthcare providers are challenged with figuring out, how to design pilots, how to do pilots, how long the pilots need to be. So how do you, with Content Innovation Cloud, help organizations to move from experimentation to coordinated large-scale implementations?
Yeah, great question. We've been particularly successful because of our deep history in healthcare. Hundreds of customers globally, hundreds of healthcare systems globally relying on us as their data foundation for unstructured data, relying on us for governed consumption of their unstructured data, and now relying on us to AI enable the business processes that these organizations automate, leveraging our technology. That, combined with our deep understanding of our customers' operations, their business processes, is what enables us to build specific agentic solutions. We don't show up with an agent builder and say, build whatever you want. We show up with deep domain understanding and expertise and solutions, agentic solutions, to drive confidence in deployment and to do so at scale. That's our approach. Metro North Health out of Queensland in Australia is relying on us to build a unified foundation of data. They had multiple PACS systems for radiology, for medical imaging. We've rationalized all of that into one trusted foundation of one trusted archive for all their millions of images. And from there, on this foundation, we're AI enabling their operations. OU Health out of Oklahoma, millions of dollars in productivity-based gains as a result of relying on us and our intelligent medical record and intelligence correspondence for revenue cycle to drive greater productivity and faster operational outcomes, and as a result, clinical medical outcomes, patient outcomes.
It really is fascinating where we've come with data, with the AI, and making sure that, healthcare runs more smoothly. So thank you so much for stopping by here at the HIMSS TV Insider and sharing everything that you're doing at Hyland.
My pleasure, Tiaja. Thanks for having me. This was fun.